Hello, my name is Perla. I'm gonna be your nurse for today, and I'm gonna be doing a head to toe assessment on you. Do you have any questions?
No.
Okay, I'm gonna go ahead and wash my hands.
Alright.
I'm gonna wash my hands for 20 seconds. I'm gonna rinse them. Now I'm gonna lather them up. In between my fingers. My thumbs. My wrist. Under my nails. And I'm going to rinse them with my fingertips pointing down to avoid splashing germs. And I'm going to pat them dry. Now I'll use another paper towel to close the faucet. I'm going to provide privacy for us.
Okay.
Okay, and can you please provide your name and date of birth?
Aaliyah Morris, January 31st, 99.
Okay, and do you know where you are?
Rhode Island Hospital.
Okay, and do you know what day it is?
March 25th, 2019.
Okay, good. And do you know who the president is?
Donald Trump.
Okay. So now I'm going to put on some gloves and then I'm going to inspect your scalp just to make sure there's no bumps or Okay, patient is oriented ×3, alert and oriented ×3. Now I'm gonna feel her scalp. Okay, there's no lumps or bumps on the scalp. Okay, and now I'm gonna feel on your trachea, make sure it is midline, and it is. And there are no palpable lymph nodes. And now I'm gonna have you lay a little down like this and turn your head, and there is no JVD. Now the other one, no JVD. Okay, and so have you had any numbness or tingling?
No.
Have you had any nausea or vomiting?
No.
Okay, and any constipation?
No.
Or incontinence? Okay, good. When was the last time you voided?
Probably like 20 minutes ago.
Okay, and was it clear yellow?
Pale yellow, light yellow.
Okay, good. And when was the last time you defecated?
2 hours ago.
Okay, and was that normal? What size was it in color?
Small, brown.
Okay, good. Great. All right, so now I'm gonna go ahead and palpate your thorax. Aaliyah, have you experienced any pain today?
I have some shoulder pain.
Okay, and from 0 to 10, what can you rate it?
Probably like a 5.
Okay, and what makes it better and what makes it worse?
If I put like a heating pad on it, but if I lift anything heavy, it gets worse.
Okay, and have you had anything prescribed for this?
No.
Okay, well I will notify the provider. Excuse me. Now I'm gonna do your cranial nerves, so I'm gonna have you raise your eyebrows and open your mouth and stick out your tongue, side to side. Okay, good. Puff out your cheeks. Good. And smile. Great, thank you. So cranial nerves 2, 3, 4, 6, and 7 are all intact. And now I'm gonna go ahead and listen and feel on your radial pulses. And that one is positive, And that one is positive, and I'm also going to feel on your brachial pulse. And that is positive. And on your other brachial pulse. And that is positive. And now I'm going to go ahead and look at your hands. I'm checking for clubbing. And now I'm going to do capillary refills on each finger. Capillary refills are less than 3 seconds. And Aaliyah, have you had any vision problems lately?
No.
Okay. So let me just go ahead and check your vision. I'm gonna go ahead and turn the lights off for a second. And just keep looking straight at me. Okay. All right, great. And I'm just gonna go ahead. Can you swallow for me, please? Thank you. All right, and I'm gonna check your sclera and conjunctiva. Okay, your sclera is white and clear, and your conjunctiva is pink and moist. And now I'm gonna have you hold a nostril and breathe in, and hold the other one and breathe in. And I'm going to look inside and see. Okay, mucous membranes are good and moist. I'm gonna pull back your ear, pull up and back your ear, and check. Okay, no drainage. Everything is good. Okay, no drainage. Good. Okay, so I'm gonna have you looking at the point of my pen and look up. Keep following it. Good. So Perla was performed. Her pupils are round, equal, and reactive to light and accommodation. I'm just gonna have you open your mouth just to check if there's any lesions, no lesions, or missing teeth. I am going to go ahead and I'm going to go ahead and listen to your lung sounds. I've already palpated your thorax. So here I go. And breathe in. 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 Great. Now I'm going to have you turn on your side just so I can get your back. And breathe in. 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 Okay, great. So lung sounds were clear, no rhonchi, crackles, or wheezes. And now we're gonna do range of motion. So we're gonna have you lift your shoulders up. Great. And now we're gonna have you turn an arm at a time in a circle. Great. Now your other arm. Okay, good. I'm gonna have you push up on my hands. I'm gonna have you push down and push against and squeeze my fingers. And okay, so strength is bilaterally strong, and I've already checked your capillary refills. And now I'm going to do your heart sounds. Going to do the heart sounds now. I'm going to start at the aortic, where it is located at the right second intercostal space near the sternum. And now I'm going to go to the pulmonary, and it's the left second intercostal space near the sternum. And now I'm going to do Herb's Point. It's the left third intercostal space near the sternum. And now I'm gonna do tricuspid, which is the fourth left intercostal space near the sternum. And now I'm gonna do the mitral, which is the fifth intercostal space mid-clavicula. And I'm gonna listen to the apical pulse for a minute right here. Just gonna take out my watch. And I'm gonna start counting now. Okay. And the apical pulse was 78 per minute. And now I'm gonna go ahead and check your turgor really quick, just to make sure you're hydrated, and you are hydrated. So now I am going to go ahead and ask you if you had any shortness of breath or coughing.
No.
Okay, good. So now I am going to move down, and I'm going to, before I move down to your feet, I'm actually gonna have you lay down, and I'm gonna check your stomach really quick. Okay, great. Inspecting the stomach, it looks flat and no distension. I'm gonna go ahead and auscultate before I palpate. I'm starting at the right lower quadrant. I'm waiting to hear a click. And now I'm in the right upper quadrant. And now I'm in the left upper quadrant. And now I'm in the lower left quadrant. And bowel sounds are active. Now I'm gonna go ahead and palpate. Let me know if anything hurts. All right, and I'm gonna go ahead and percuss. Okay, good. Everything seems normal. You can go ahead and sit down. I've already asked you how was your defecate today, and you said it was normal.
Yeah.
And so I'm gonna have you push up on one of my hands. Good. And the other one. Good. And now I'm gonna go down. And is it alright if I take your socks off? Okay. I'm gonna go ahead and take your socks off because I'm gonna check for clubbing and capillary refills. So there's no clubbing. And capillary refills are all less than 3 seconds. Now I'm gonna check for the pedal pulse. That one is present. That one is present. And now the post-tibial pulse. That one is present. That one is present. Now I'm going to check for edema. There's no edema present. And I'm also gonna have you point your feet up and then Point them up and then dorsiflex them down. Great. Point them up, dorsiflex. Thank you. Point them up and dorsiflex. Thank you. Okay, that's good. I'm gonna have you put your socks back on. Okay. Now I'm gonna have you walk a few steps just to see your gait. That's good. Come back. Gait is great. So her gait is perfect. She is bilaterally strong on both of her legs. Her capillary refills were less than 3 seconds. She had pedal pulses, post-tibial pulses, no edema, and I also assessed her skin while I was doing. Is there anything else like in that I haven't seen on your skin?
No.
No? Okay, so skin is clear. No cuts, bruises, or scrapes. Thank you so much for being my patient today.
Thank you.
You are all set.